Center Test Prep Exam Club. Question 1. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is Option A, diltiazem, Option B, verapamil, Option C, metoprolol, Option D, digoxin. The correct answer is Option D, digoxin. Digoxin can be used for rate control in atrial fibrillation, particularly in patients with heart failure. Non-dihydropyridine calcium channel blockers, diltiazem, verapamil, are typically avoided in FREEF due to their negative inotropic effects. Beta blockers may be used, but digoxin is often preferred as an adjunct or alternative. Question 2. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is Option A, absent breath sounds, Option B, dullness to percussion on the affected side, Option C, trickle deviation, Option D, subcutaneous emphysema. The correct answer is Option B, dullness to percussion on the affected side. With hemothorax, blood in the pleural space, percussion produces dullness due to fluid. In pneumothorax produces hyperresonance due to air. Both cause decreased breath sounds. Question 3. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A, abdominal X-ray, Option B, abdominal ultrasound, Option C, CT scan of the abdomen, Option D, complete blood count. The correct answer is Option C, CT scan of the abdomen. CT scan of the abdomen with for contrast is the most accurate imaging modality for diagnosing appendicitis, though ultrasound is often the initial test in children and pregnant patients. Question 4. The most common cause of airway obstruction in an unconscious patient is Option A, laryngospasm, Option B, foreign body aspiration, Option C, the tongue, Option D, mucosal edema. The correct answer is Option C, the tongue. In an unconscious patient, loss of muscle tone allows the tongue to fall posteriorly and obstruct the airway. The jaw thrust or head tilt forward/chin lift maneuver is the initial intervention. Question 5. A patient presents with cholinergic symptoms, salivation, lacrimation, urination, defecation, GI upset, emesis, meiosis. This toxidrome is most likely caused by Option A, anticholinergics, Option B, sympathomimetics, Option C, cholinergics, organophosphates, Option D, opioids. The correct answer is Option C, cholinergics, organophosphates. The classic sludge salivation, lacrimation, urination, defecation, GI upset, emesis, meiosis, presentation is the cholinergic toxidrome, caused by organophosphate or carbamate poisoning. Question 6. The purpose of administering surfactant to a patient with ARDS is to Option A, bronchodilate the airways, Option B, reduce alveolar surface tension and prevent atelectasis, Option C, decrease pulmonary capillary permeability, Option D, increase mucociliary clearance. The correct answer is Option B, reduce alveolar surface tension and prevent atelectasis. Surfactant reduces surface tension in the alveoli, preventing alveolar collapse, atelectasis, and improving gas exchange in conditions like ARDS. Question 7. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes Option A, hypertension, bradycardia, headache, Option B, abdominal pain, hypotension, and a pulsatile mass, Option C, fever, chills, flank pain, Option D, dysuria, frequency, urgency. The correct answer is Option B, abdominal pain, hypotension, and a pulsatile mass. The classic triad is abdominal or back pain, hypotension, and a palpable pulsatile abdominal mass. However, the triad is present in only a minority of patients. Question 8. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, trickle deviation to the left, and hyperresonance to percussion on the right. The priority intervention is Option A, obtain a stat chest X-ray, Option B, needle decompression at the right second intercostal space, Option C, administer albuterol nebulizer, Option D, prepare for intubation. The correct answer is option B, needle decompression at the right second intercostal space. The presentation is classic for tension pneumothorax, trickle deviation away from the affected side, hyperresonance, absent breath sounds, and respiratory distress. Immediate needle decompression is life-saving. Question 9. A patient presents with a chemical eye splash. What is the priority nursing intervention? Option A, patch both eyes. Option B, immediate copious irrigation with water or normal saline. Option C, administer topical antibiotic drops. Option D, perform a visual acuity test. The correct answer is option B, immediate copious irrigation with water or normal saline. Immediate and prolonged irrigation of the affected eye to dilute and remove the chemical is the single most critical intervention to prevent permanent corneal damage. Irrigation should precede any other assessment. Question 10. When receiving a verbal or telephone order in an emergency, the nurse should: Option A, carry out the order immediately without verification. Option B, write it down and read it back to the provider for verification. Option C, ask another nurse to take the order. Option D, refuse to take verbal orders. The correct answer is option B, write it down and read it back to the provider for verification. The best practice for verbal or telephone orders is the write down. Question 11. The hallmark sign of compartment syndrome is: Option A, pain relieved by elevation. Option B, pain out of proportion to the injury. Option C, absent pulse in the affected extremity. Option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Pain that is severe, unrelenting, and disproportionate to the physical exam findings is the classic early sign of compartment syndrome. Pain with passive stretch of the muscle is also characteristic. Pulselessness is a late and ominous finding. Question 12. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A, tachycardia. Option B, narrowed pulse pressure. Option C, hypotension. Option D, tachypnea. The correct answer is option C, hypotension. Hypotension is a late and ominous sign of shock in trauma, especially in young, otherwise healthy patients. Compensatory mechanisms, tachycardia, vasoconstriction, can maintain blood pressure until 30 to 40% of blood volume is lost. Question 13. In a multiple casualty incident, the triage tag for a patient with breathing 30/min, no radial pulse, and who does not follow commands is: Option A, green, minor. Option B, yellow, delayed. Option C, red, immediate. Option D, black, deceased/expectant. The correct answer is option C, red, immediate. The START triage system categorizes this patient as red, immediate. Respiratory rate, 30 and altered mental status, doesn't follow commands, are both criteria for red. The presence of a radial pulse is a positive finding but does not downgrade the urgency. Question 14. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to: Option A, insert a urinary catheter immediately. Option B, perform a retrograde urethrogram before catheter insertion. Option C, irrigate the bladder with normal saline. Option D, prepare for suprapubic catheter. The correct answer is option B, perform a retrograde urethrogram before catheter insertion. Blood at the urethral meatus is a classic sign of urethral injury. A retrograde urethrogram must be performed to assess urethral integrity prior to any catheter insertion attempt. Question 15. A high femur involves: Option A, retinal detachment. Option B, blood in the anterior chamber of the eye. Option C, ruptured globe. Option D, corneal laceration. The correct answer is option B, blood in the anterior chamber of the eye. A high femur is a collection of blood in the anterior chamber of the eye, usually from blunt trauma. The patient is at risk for rebleeding and elevated intraocular pressure. Question 16. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is: Option A, application of ice to the bite. Option B, incising and suctioning the wound. Option C, application of a tourniquet proximal to the bite. Option D, administration of antivenom, crotalidase. The correct answer is option D, administration of antivenom, crotalidase. The definitive treatment for significant pit viper envenomation is antivenom. Outdated first aid measures, ice, incision/suction, tourniquet, can worsen tissue damage. Question 17. Ovarian torsion presents with option A, bilateral lower quadrant pain. Option B, sudden, severe unilateral lower abdominal pain with nausea. Option C, painless vaginal bleeding. Option D, fever and purulent discharge. The correct answer is option B, sudden, severe unilateral lower abdominal pain with nausea. Ovarian torsion typically presents with acute onset, severe, unilateral lower abdominal or pelvic pain, often accompanied by nausea and vomiting. Question 18. A patient with a history of alcohol abuse presents confused and ataxic. To rule out Wernicke's encephalopathy, the nurse should prepare to administer option A, folic acid, option B, vitamin B12, option C, thiamine, option D, magnesium sulfate. The correct answer is option C, thiamine. Wernicke's encephalopathy is caused by thiamine, vitamin B1, deficiency, common in chronic alcoholics. Thiamine must be administered before or with glucose to prevent precipitating or worsening the condition. Question 19. Fat embolism syndrome is most commonly associated with fractures of the option A, distal radius, option B, pelvis and long bones, option C, clavicle, option D, metatarsals. The correct answer is option B, pelvis and long bones. Fat embolism syndrome occurs when fat globules from bone marrow enter the circulation, most commonly after fractures of long bones, femur, or pelvic fractures, causing respiratory distress, petechiae, and CNS changes. Question 20. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to option A, administer oxygen, option B, place the patient in Trendelenburg position, option C, immediately discontinue the procedure, option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. The nurse should instruct the provider to immediately stop the procedure to reduce vagal stimulation and prevent syncope. After the procedure is stopped, the patient can be placed supine and assessed. Question 21. A patient who has received massive blood transfusion protocol is at risk for which electrolyte abnormality due to citrate preservative in blood products? Option F, hyperkalemia, option B, hypercalcemia, option C, hypercalcemia, option D, hypomagnesemia. The correct answer is option C, hypercalcemia. Citrate, a preservative in transfused blood products, chelates ionized calcium, leading to hypercalcemia, which can cause paresthesias, tetany, and cardiac dysrhythmias. Question 22. A patient with a Le Fort 3 fracture is at highest risk for option A, dental malocclusion, option B, airway compromise, option C, corneal abrasion, option D, temporomandibular joint dysfunction. The correct answer is option B, airway compromise. A Le Fort 3 fracture, craniofacial disjunction, can cause posterior displacement of the maxilla and soft palate, which can obstruct the airway, making airway assessment the highest priority. Question 23. Meningitis is an inflammation of the option A, brain parenchyma, option B, meninges covering the brain and spinal cord, option C, peripheral nerves, option D, ventricles of the brain. The correct answer is option B, meninges covering the brain and spinal cord. Meningitis is inflammation of the pia mater, arachnoid mater, and the cerebrospinal fluid within the subarachnoid space. Encephalitis involves the brain parenchyma. Question 24. The most effective method to control severe bleeding from an extremity wound is option A, elevation, option B, direct pressure, option C, pressure point compression, option D, ice application. The correct answer is option B, direct pressure. Direct, firm pressure applied to the wound is the most effective initial method for controlling severe external hemorrhage. Tourniquets may be used if direct pressure fails. Question 25. A positive Koenig sign is suggestive of option A, cerebral aneurysm, option B, subdural hematoma, option C, meningeal irritation, option D, cerebellar stroke. The correct answer is option C, meningeal irritation. Koenig sign, pain and resistance with knee extension when the hip is flexed, and Brodzinski's sign are physical exam findings indicating meningeal irritation, often seen in meningitis or subarachnoid hemorrhage.